In the same way that dancers move their bodies in order to convey emotion or meaning, the proteins in our bodies can move and change in order to convey a biological signal. Understanding that movement is essential when the protein is related to disease. The protein of interest in my PhD is insulin. This small protein has a big impact on our lives. It is responsible for regulating blood sugar levels, and when there are problems with insulin production or processing, this leads to the development of diabetes. Millions of people around the world suffering from diabetes require daily injections of insulin as part of their treatment. However, the delicate balance achieved by insulin in healthy bodies is very difficult to replicate in diabetic patients. To solve this, we are constantly looking for better alternatives and improvements in diabetes treatment. However, in order to find better alternatives to insulin, we first need to fully understand how it works on a molecular level. Researchers have been able to capture snapshots of insulin in different positions, but there is missing information about how it moves between these states. A potential source of this movement and the subject of my PhD are disulfide bridges. You can think of these as the joints that control a dancer's limbs. These joints exist within insulin and are known to be really important for the shape of the protein as a whole. What we don't know is whether they're also responsible for changing its shape in order to influence its biological activity. The goal of my PhD is to investigate how the shape of these bridges in insulin affect the way the protein dances in the body. However, because disulfide bridges are so flexible, it is hard to study how they move, and to know which of their many possible shapes is important for the structure of the protein. So far in my PhD, I have found new ways to replace insulin's flexible disulfide joints with specially crafted carbon-based bridges. These carbon-based bridges have well-defined shapes and reduced movement, which allows us to assess the effect the shape has on the protein as a whole. To use our dancer analogy again, it is as if I'm teaching a robot a series of known dance moves in order to see if it can match the intricate combinations performed by a prima ballerina. My PhD will also assess how these new forms of insulin act within biological systems. This data will allow us to fill in the blanks in understanding insulin movement. By looking at how the different shaped bridges act in the body, we can see how the joints are changing the shape of the protein and affecting bioactivity, in the same way that the shoulders connect and move the arms in order to convey an expressive dance. Understanding the dance of insulin's disulfide bridges is essential to understanding how this powerful protein functions in the body. And with this knowledge, we can develop more effective therapeutics to treat diabetes.